This week celebrates National Infant Immunization Week as well as World Immunization Week. I am a Vaccines for Children consultant for the health department, and one of the biggest concerns I hear from healthcare providers is, how do I talk to that parent who's vaccine hesitant? So today our panelists are going to discuss exactly how to do that, particularly for parents who are afraid of vaccines. Our 5 panelists today are Dr. Brian Ellis. He is a board-certified pediatric physician and began practicing in Norman in 2009 with Drs. Fox and Fields. Dr. Ellis earned his medical degree from the University of Oklahoma and completed his pediatric residency at the Children's Hospital at Scott and White in Temple, Texas in 2009. Dr. Paul Dardin, at the other end, is a professor and section chief of general and community pediatrics at OU Health Sciences Center. Dr. Dardin received his medical degree from the University of Texas Southwestern Medical School. Recently, he has published a paper in Pediatrics entitled Reasons for Not Vaccinating Adolescents, National Immunization Survey of Teens, 2008-2010, and there are copies available on the back table. Tom Hibben is an EMT and father of 3 boys. He also owns a photography business with his wife, Samantha. When he's not taking pictures, saving lives, and raising his kids, Tom writes a popular and often funny blog called Adventures in Aspergers about balancing everyday life and raising a child on the autism spectrum. Recently, Tom was interviewed for an article in the Canadian press about kids on the autism spectrum appearing in television. From Norman Pediatric Associates, we have Dr. Thomas Kuhls. He is board certified in pediatrics and pediatric infectious diseases and is a member of the American Academy of Pediatrics. He is a former professor at the University of Oklahoma, OU Medical Center, a published author, and currently serves on the Drug Utilization Review Board for the state of Oklahoma. Dr. Kuhls enjoys learning and is constantly researching and reviewing advances in pediatric medicine to provide the best care to his patients. Kristen Russell in the middle is the immunization nurse for Cleveland and McLean counties. She completed her bachelor's at the University of Oklahoma and has been with the health department for 2.5 years, where she has developed a passion for immunizations. She is actively involved in the Cleveland County Immunization Coalition to improve education in the community. Kristen also currently works as an instructor at Moore Norman Technology Center. We will be asking questions previously submitted by the audience, and at 10 till 1, the panelists will have an opportunity to summarize their comments, and we'll close the discussion. Like I said before, the discussion will be available on our Facebook page for you guys to view later or to send to friends who didn't get to come. Okay, well, panelists, let's get started. What seems to be parents' major concern about vaccines? Dr. Kuhls, do you want to start with that one?
Actually, had Paul start, since that's really what his paper was. But
oh. Well, I should disclose that Dr. Kuhls and I actually go so far back that we actually were in residency together in Dallas back when prescriptions were written on stone tablets.
very true.
So parents do have a lot of concerns about vaccines. A lot of it is sort of unfocused. I mean, to some extent, vaccines can seem a bit unnatural, and diseases may seem more natural to them. There's always the concern about, you know, when it's more focused around safety of the vaccines. And in fact, for adolescents, I think that's the growing concern, especially around HPV. It is worth, you know, letting them know that vaccines are probably among, if not the best studied and safest of medical interventions that we have, as is only right. These are things we do to well children and adults, and they should be safe.
Anyone else like to add something?
One of the things that I've found is that a lot of times, especially with younger parents, is that they have no source of reference for how bad some of these diseases are. And so because they've never seen these diseases firsthand, and they just don't have that same fear that my parents and some of the older generation have about what these diseases are. So they're more scared about these, the small risks that we see with the vaccines than they are of the diseases, just because they haven't seen them and it's not as prevalent. And I think that's one of the biggest things that drives people to be scared of these diseases or these vaccines.
As physicians or even parents or nurses, what are the vaccines that parents are most concerned about, or are there specific vaccines? That one's a free-for-all.
Well, I mean, I think that, I get parents that question everything from the first hepatitis B vaccine through the, very popularized MMR vaccine. I mean, so they target kind of all of them, but I think that, you stating that they're kind of an unfocused fear is very true, in that, some parents come in and they do have a focused, I don't want to get that autism shot because I don't want to give my kids autism. And, that's, all stems back from, the MMR vaccine. And so we have a lot of concerns about that, but I'm finding parents that question not only that, but the rest of them as well. And so I think it is kind of very unfocused and typically stems from lack of knowledge about what these vaccines are preventing and how they work.
Yeah, I agree. I mean, the main one I hear problems with at first, years ago, especially in the autism community and those who were in fear of autism, was MMR, just because of really misinformation and bad advice. And now it's really just spread like wildfire, and it's all vaccines are just lumped into the same thing. So I think it's misinformation as far as whether it be celebrities or news or my friend's cousin or whoever you want to hear that from. So, but MMR by far is the one you hear the most about.
Dr. Dardin, did you have something to add?
So the literature would suggest that, which was a surprise to me because MMR is what I hear so much about, but actually the varicella vaccine appears to be the one that is most frequently refused. Probably a combination, as Dr. Ellis was talking about, a disease that they don't view as that severe and a vaccine that they don't see that they need as much. So varicella was the one that is most, but of course, the older you are when you get chicken pox, the worse it is. And if you've ever known an adult who's had chicken pox, I doubt that they would say that it's a minor disease. So it is one of those issues. Now for adolescents, again, it's probably the HPV vaccine is the most commonly refused. But I would agree that you'd get some unfocused fears around those. But I was very surprised by the literature that said the chickenpox vaccine.
Okay. This question is one that healthcare providers often get. How do you answer, isn't there some way besides vaccination to protect babies against these diseases?
Actually, there is. If we take children and we put them in bubbles, then they won't get those diseases. But other than that, the way society runs, the way that people are around other people, there is definitely no other way to prevent disease other than vaccination. You can try all you want, you can do all the public health you want, but if you're going to really reduce disease, the only way to effectively do that is with vaccines.
Any other comments, Kristen?
Yeah, and I think for the nurses here at the health department, what we hear a lot is, it's okay, I will keep my child away from everyone. The only places that we ever go outside of the house are Walmart and church. So it's another misinformation piece there that I think a lot of people are thinking that they're protecting their child, but really exposing them to a lot of things as well.
I just want to add, I agree, Walmart's not a safe zone. So, I'm just saying.
Dr. Dardin, did you have another comment?
Well, just that, one of the ways we protect against disease, because not everybody can be immunized, and immunizations on rare occasions do fail. And the way we protect people is by immunizing everybody else. And so one of the main ways is that everybody be immunized is a huge part of protection against disease. So there's also that community effect.
Another question parents often ask is, isn't all this talk about diseases just a way to scare parents so they'll bring their babies in for shots?
I guess the short answer to that is sort of yes. These are diseases that are scary. We don't have as much experience anymore. I mean, I think there's both public health and historical interest in looking at those wards of iron lungs from the polio era to realize that these are diseases that were sort of bad. I did some focus groups once around, how do we, and they didn't like that the people with the diseases were not photogenic. And so we actually did posters of beautiful people with, beautiful children with diseases. The focus group liked them, and they actually, I still have some in my office somewhere. But these are real diseases, and saying that they're scary is true, but it's really more of a reason rather than just to scare them.
Early in my career, when I was doing my infectious diseases training, the last thing that I wanted to do is learn about vaccines, and this was a long time ago when we had regular DTP and so on. And I remember one of the people that trained me used to talk about, man, we used to see these people with polio and all these iron lungs and all this stuff about polio. And I used to sit there and I go, oh man, polio, I've never seen a case of polio. And then during training, Paul will tell you that Paul and I stood up nights in Dallas, probably with at least 1 to 2 kids on the floor with Haemophilus influenza type B meningitis nightly through the winter months. And now, Dr. Milligan, who's down here, has told me he's never seen a case of Haemophilus influenza meningitis because of vaccine, which is, and now it's just truly amazing to me to not see that disease. And it just shows you that now I'm the old person, and it's going to go on. Dr. Milligan will be seeing diseases now that hopefully in the future we're going to have vaccines for. And then the next generation of doctors is not going to see those diseases. And it's hard when you're young to talk about serious diseases that you've never seen before. But in reality, those diseases are deadly and serious, and we're now able to prevent them. And so now the way I view vaccines is entirely different than when I was young. It's just, we need to give shots, we need to prevent these diseases, and I really honestly believe that probably vaccines are probably the best thing that I do as a pediatrician. I try hard in all these behavioral illnesses, and I try hard to make my families eat more healthy, but one thing that I do very well is I prevent disease when I can give that vaccine, so it's very important.
Any other comments? Okay. This is actually a 2-part question. Do you see many parents asking to delay vaccines, and what do you think of using an alternative schedule? Anybody? Dr. Ellis?
We do see a lot of, we have, several parents that I have in my clinic and in our clinic that do want to delay vaccines or use an alternative schedule. And do I like doing it? No, I don't. I really want to follow the schedule. I want to get them their shots. But, if we can, sometimes you pacify the parents to win the war. And that's kind of the way I look at it is that, I'll give up and do just 2 at a time as long as the parents are coming in and getting them. And so we get these kids protected as quickly as we can. I'd like to live in a perfect world where we can do, get all of them at once and get them all done for every patient, but, it's just, with, like I said, all of the misinformation that parents get, if that's the compromise that I have to make in order to get the rest of the kids, their vaccines, that's what we do. So, I don't like it, but.
I would love to give all my vaccines to somebody who's 18 years old. But unfortunately, the reason why we give vaccines at certain times is because those are the times when those children are at most risk for disease. We start with pertussis early because kids that die early of pertussis. We do HPV late because HPV is not a problem in a 5-year-old. So that you have to be careful in terms of talking about delaying vaccines and using alternate schedules. Because there's a number of studies that say that if you do go ahead and try to do alternate schedules and delaying vaccines, that ultimately in large populations, kids don't get vaccines and kids are at more risk of disease. There's been a number of studies, Georgia, and so on. So the way I answer this question is, I will listen to the parent and I will somewhat delay or somewhat use an alternate vaccine schedule as long as the schedule that's being used is within the time frames for accepted and recommended times for giving vaccines. So that, for instance, I don't think that every child, for instance, needs a hepatitis A vaccine at 1. It can be given at 15 months. It can be given at 18 months. So that I have some leeway as long as we stay in Red Book AAP recommendations or ACIP recommendations. But the big key is you don't want to get so far behind that you put the child at risk for that disease, because if you do, what's the use of giving vaccines at all?
I actually, the patients that I typically take care of are Medicaid, and I don't see much of this. I don't see much requests for this. On the other hand, I couldn't agree with Tom more. There's a real reason for the schedule, and by delaying it, you're increasing their risk of disease. And that leads to something that is a little bit personal and also for my patients. I want to practice the best medical care that I can, and I want my patients to receive the best medical care they can. And delaying vaccine by increasing risks is really not the best medical care. You're really giving them a worse quality of care than they could have otherwise. And that's not good. I'm also a health services researcher, so I look at systems of care. When you start doing things out of the system by delaying, doing special cases, things get dropped, they get missed, they don't get done. And just like Tom was saying, you end up with a population of children less well immunized because something is going to get forgotten for some of the kids.
Tom or Kristen, do you have any additional comments? Okay. Well, that kind of leads into how do you feel about excluding patients from a practice because their parents refuse to vaccinate?
You can go first.
It's not something that I do. It is something that I understand, however, because a child that is unimmunized is a risk to themselves for sure, but they're also, to some extent, also a risk to the patients out in the waiting room. It's also a really frustrating thing for pediatricians to try to take care of is a child that a parent who is not, that you're spending a lot of time and they're not willing to do what you think they should do. But again, it is something that is sort of hard for me to understand as well, but I do understand it, and I do feel for I don't disagree with pediatricians that do it.
I'm glad you understand me.
I didn't say that.
When you go to a pediatrician's office, it's not like going to the store. You can't, when you go to the store, you can sit there and say, I want to buy this, but I don't want to buy that. And when you go to a pediatric office, it's a matter of that pediatrician trying to offer the best medicine and the best care and the overall total picture of care of that child that you can. And so when somebody comes to me and sits there and says, I don't want you to ever give any vaccines to my child, that tells me that they're looking to go to a store where they're going to pick my care in terms of nutrition, but they're not going to choose my row of vaccines. And to me, since this is an overall total care of a child, they're not going to fit into very well the picture of what I feel of a healthy child should be. And so what I usually tell the parent is, you know what, you probably can find this another physician who doesn't mind it, who just wants to go ahead and take your money into another well child check. That's not what I'm there for. I'm there to provide health for your child. You know, maybe they'd be happier going to the Homeland, you know, where they have the little clinic. I don't know. But to me, yes, you can make the arguments that that child's putting your other children at risk in the waiting room and so on. But to me, vaccines is part of the whole total care. And if that family isn't going to believe in that fundamental thing that I believe in, then there's probably physicians out there that can provide their care that they want, and it's not going to fit my practice. So I have no problems doing it.
Sorry, real quick. Just both being in EMS and in emergency medicine in the ER, and then having 3 boys who are, 2 of them are just all around sickly. They're not strong kids. They're Jewish. What do you want to do? You know, it's in as many doctors' offices, whether it's occupational therapy, you know, physical therapy, you know, therapy, regular pediatrician. It's about, I agree, trusting the doctor to know that they're going to do everything. And if it's not up your alley, it's like I'm not going to ask the pediatrician to come to my house and tell me how to organize the garage, because that's my job, and I'm not going to tell him you take care of the kid. So, so as a parent, I agree. I think it's okay, and I think that's an acceptable risk. If you don't want the vaccinations, then, you know, if you don't want the care, then maybe you should find a different doctor.
The parents who just flat out refuse vaccines are probably one of the most frustrating things, I think, for any of our offices, if not all of our offices. And the one thing that I try to do, because I do have some families that just, you know, that don't vaccinate, and I don't exclude people from our practice, and we don't. And one of the biggest reasons why is that I feel like if we don't see them, then we're going to miss out on the opportunity to educate the parents. And so that's, you know, it is frustrating and it is time consuming to go over the same stuff with them every time, but that's one of the things I tell them they know first off is that I'm a big proponent of vaccinating kids, and I think that it's the right thing to do, and I believe in the vaccines and believe that they're safe and they're effective in their jobs. And I'm going to use every opportunity I can to help educate the parents. But one of the things that I found, though, is that a lot of parents, if we exclude them from our practice, a lot of times they won't go find a new physician, and then we have kids that aren't being seen for anything except for in the ER when they're really sick or something like that. And I think that that's one of the things that we struggle with is trying to educate these parents and trying to get them back into the system and trying to get them, because maybe I can get them just to get the DTaP to help prevent diphtheria and tetanus, because those are things that are kind of big in the news right now. And if we can get them that one, then maybe next time we can get them something different, and we can keep working on them like that. So that's why I continue to see them.
We'll skip a couple questions since we're running out of time. How do you talk to patients who have chiropractors as parents? Do you talk to patients who have chiropractors as parents? How do you talk to patients who have chiropractors as parents? Or parents who are chiropractors?
Chiropractors are a diverse group, by the way. I mean, I've had chiropractors who have no problems with immunizations, and it's not been a problem. I've had others who don't believe in the medical medicine at all, and so it's an interesting thing. I'm not sure where, but the ones I've met that don't believe in medicine, I've only seen socially. I've actually never, presumably they don't go to doctors. So I don't necessarily characterize chiropractors in one group. Just like I don't do back pain, I hope they don't think about doing immunizations. And if they know their limits, then I think we're okay. But there's also some websites run by chiropractors, one in Georgia specifically, that has a guide for how do you keep your children from getting immunized. And it actually has, for the state of Georgia, what are the rules and how can you circumvent mandatory immunizations. So, but I've never actually had one in the office, so if anybody
other?
has.
Oh, okay. Well, I guess you don't talk to them. This question is actually mostly for Tom. Do you find that vaccine hesitancy is common among parents of children with the autism spectrum disorder?
Yeah, very common. There's two schools. You either have the parents who don't buy into it, or the ones that take it to a new level, if you will. And I think most of those that I come into contact with, whether it be visitors to the blog or whether it be people who at conferences, there's organizations, especially the ones attached to celebrities, that just put out all kinds of good stuff. And by good stuff, I mean nonsense. It's a lot of education problems. And it's like I said earlier, at first it was MMR is going to cause autism, and then it was just all vaccines, and now it's if I eat a hot dog while I'm pregnant. It's really scary how it just spreads like wildfire. So I think that's probably at first diagnosis or deciding to go pursue a possible diagnosis to find out what's going on is also an issue with vaccines, because that's a lot of times about the same time as they should be getting vaccines. So it's like they have a little idea that something may be different, and at the same time they've heard all these things about vaccines and autism and other disorders that are supposedly caused by vaccines. So,
and it seems like, I don't know if this is your experience, but those people seem to have the loudest voices that seem to project to everyone. I mean, everyone comes in, knows someone who has autism or has a cousin's friend, sister, that kind of relationship where autism is prevalent. So it's very tough to work against their Aunt Rita's advice because Aunt Rita raised them. So it's really, a lot of times we work as providers against knowledge that they have grown up to be just fact. And so it is a hard deal to re-educate them in the few minutes that you have with that family.
Actually, Tom's answer really struck a chord. Parents of autistic children are passionate people, and they passionately are concerned about their children's care. And in fact, my approach to vaccine hesitant patients was changed and influenced by the president of the Autism Science Foundation, Allison Tepper Singer, and the former vice president of Autism Speaks, who really talks about how to approach children, or how to approach the parents of children who are vaccine hesitant. And one of the things, she talks about it in terms of you acknowledge their fears and don't denigrate them. That you also talk about your qualifications and what you know about vaccines. You talk about the science behind it. And then one of the clear things is that you need to give a very clear recommendation for what you think is best. One of the things that sometimes can happen when faced with somebody who is hesitant or uncertain is to sort of present sort of a Socratic balancing and not come to, this is what I think you should do. I, as a physician and an expert in this area, think that, this is the best care for your child. And I actually realized I did it. I would say, well, this is the evidence, and sort of leave it to them without bringing it to the conclusion. And actually, I got that from, Allison Singer. So.
I spend a lot of time with my families with autism. And the reason that I do that is because, number one, the whole field of autism has been ignored by the medical community until recently, until the last probably 5 to 10 years, where we're starting to now really get some decent research to start having some fundamental understanding of autism. And so, as a parent of an autistic child, especially a number of years ago, there were so many false things out there to make money in terms of treatments, chelation, and you can go on and on and on, because the medical community didn't give any opportunity to treat children with autism very well. And we're doing a better job now, but it's relatively new. And so that when the whole concept of autism was associated with MMR and so on, the autistic community, the families with kids with autism jumped on it because they were searching for answers, and the medical community couldn't give them to them. And they were searching for treatments, and we didn't have any. And so it caught on like wildfire. So you have to spend a lot of time talking about the facts, spending time talking about Wakefield, talking about how he was basically a crook, that he lied in his literature, that it was all false to make money out of a company that he had developed. He had to talk about all the literature that shows that, no, there is no relationship. This is something that has been looked at by the medical community. Because when you have a child with autism and your younger child is now time to have vaccinations, you're going to be worried, and I understand that. So you have to spend a lot of time and tell them the true story of really how the MMR and the autistic situation happened, and how, it was, you talked about all the movie stars and everything. It all had to do with dollars and trying to get dollars for care. And that's what it was basically all about, even though there was no association at all. So I really do. And I take a lot of time talking to the parents about that.
I just had one more thing. I agree. I mean, you almost have to take that extra time because it consumes your whole life. And my son's super high functioning. It's like he's in the 4th grade, but on a 9th grade level, but he puts on his pants backwards every single day for the past 4 years. It's every single day. So we have 4 foods we'll eat, and that's it. So if it's not chicken nuggets, and if it's not round, and it's not the right consistency, it's not happening. And I find a lot of these parents that are MMR hesitant, or even just vaccination hesitant, especially after their first child has been diagnosed, they know about the Wakefield thing, and they've heard about it, but they haven't heard the conclusion. They don't know, they just heard the story, and that was it, and they don't know about charges, and they don't know about, the discreditation. And so giving them a clear picture of the whole story and why, and educating yourself so you can answer those questions is really the best medicine for it. So,
Dr. Ellis, did you have anything to add?
No, I think they all summed it up very well.
Okay. Last question, maybe we can add one more. What reputable sources of information on vaccine safety do you refer your parents to?
Well, I send them to the CDC and the AAP. I mean, those are the best sources we have. There's where you can get links to the most accurate and most recent studies. So that's where I send people to. And then I try, in the few minutes I have, to kind of interpret some of the information when they do bring this stuff to me.
Dr. Dardin?
Oh, I'm an academic, so I have lots of places that I send them to. But the CDC is a big one, the American Academy of Pediatrics, so the government, professional organization, the Children's Hospital of Philadelphia immunization site is great. The Immunization Action Coalition, immunize.org, every form you ever wanted to have. It's a confusing site for providers. It's wonderful. And I also use the Autism Science Foundation site. And Autism Speaks isn't quite as good, or I don't think isn't as specific about vaccines as the Autism Science Foundation. So I usually use that one for parents who are concerned. But I try to give them a variety because, some people don't like the government, some people don't like universities. So trying to sort of give them a variety of places that I think are good sites.
Any other advice? No? Okay. Last question before we summarize and conclude. What is the best way to prepare parents for an immunization visit?
I guess something simple that I do on every well child check. Say I'm seeing a 2-month-old. And so I spend a lot of time on my 2-month-old visit talking about the shots that I'm going to give today. Okay? More than a lot of the other visits. Because then what I do at the end of that talk about each one of those vaccines is I say, and the good news is that all the way up until we give our MMR and varicella at 15 months, we're not going to give any new vaccines after this visit at 2 months. So that when they come back at the 4-month visit, I ask them, how did we do on the 2-month visit? And most of the kids don't have any side effects at all or a little bit of fussiness or whatever. I go, well, good, because we're not going to give anything different that we didn't give the last time. All right? And you can go all the way from 2 months to the way we do it, 15 months of age to that way. And then when we get to do new vaccines, then I spend the same thing over again. Talking about that vaccine and stuff, and I say, good, we're not going to give another MMR or varicella until 4 years of age. And when I get to the 4-year age, I go backwards and say, how did we do on that vaccine? Well, we didn't have any side effects, or most of the time they don't remember. And then it eases the parent in terms of, well, they've already had that before, and so this is nothing new. So if you can spend your time on your talks for the first time that you give that vaccine, and then reinforce that you haven't had any side effects on the next ones. For a vast majority of people, you do well. It's just convincing them to get the vaccine the first time.
Any other comments or suggestions?
Well, I think here at the health department, we try to employ the parents as much as we can in helping comfort the child using comforting measures, bringing a stuffed animal or a blanket or breastfeeding shortly after, whatever works best to help comfort that child. But to help the parent get involved is a big piece, I think, in that, because not only are they just sitting watching you do all of this, they're getting to help calm their own child down and prepare them for the future visits as well.
One thing that I think we see a lot is the exact opposite, which is the parent who's in there and the kid's acting up a little bit, and the mom says, "Be good, or we're going to give you shots." That just, it kills us, because this is not punishment, and we know it's not punishment, but convincing parents that it's not a punishment. This is something to help promote health, and that's that's one of the biggest things I hear, and it just drives you nuts when you hear parents say that. So. Try not to let your parents say that kind of stuff. And I usually try and say, hey, this is not a bad thing that we're doing here.
Dr. Dardin, do you have a comment?
I'll say something to that. I mean, I hate to disagree with you, but I disagree. I think shots are bad. I think they hurt. I think they're horrible. I think they're terrible. I don't think they're anything good. Are they necessary? They're important, yes, but they're not good. And so, I try not to pretend with parents that we're doing something important for health and good, but shots are bad. That's why I hope that in the next 30 years that we're able to develop new techniques and new ways to give vaccines where they don't hurt. We can do a better job. Let's take influenza vaccine, okay? Influenza vaccine is important. It's a good vaccine, but it's not perfect. There has to be new vaccines where we give one shot and we're going to be protecting for multiple years instead of each new year. We have to have new technologies, like some of the newer technologies where you can hardly feel it now. Shots are horrible. And we need to do a better job medicine-wise to not have shots. But right now, that's all we have, and we're going to have to put up with a little bit of pain for the benefit that vaccines give, and that's what we're all here for.
Okay. Well, we are running out of time, so if all the panelists want to take a moment to summarize what they think everyone else needs to know about talking to parents about vaccines, you can take a minute to do that.
As I think Tom said earlier, vaccines are the most effective and cost-effective and have had the most difference on the health of children, actually of the population, of anything that we as physicians do. You have to go to public health issues such as food, nutrition, and housing and clean water to get anything that has more of an effect on health. And over my career, I've seen tremendous changes in the diseases that I care for because of vaccines. And I think it's worth making sure that parents know that these are important. But also, when you're talking to parents about vaccine, it is, important to say that, I'm an expert at this, that I do this all the time, and that this is a good thing, and you should do it. Have a clear recommendation. I'm just surprised. You should watch what just observe how you talk yourselves. It's amazing how many of us don't actually come down to a clear recommendation. And it's especially in the face of parents who are hesitant. And it's easy to say you should do it to somebody who's not even hardly listening to you and just wants you to move it on and get that shot done. And it's a little harder, it seems, to do it for those that are a little hesitant. I mean, we don't want to denigrate their their true feelings for their children, but we also want to make sure they understand what is best.
I agree with everything you said. I guess the only thing that I want to add to that is something that you addressed it a little bit, but one of the things that needs to be done is we spend a lot of time talking about practitioner-child interactions or parent interactions, but one of the things that has failed us is our media in terms of vaccines. We have let the sensationalism of vaccine injury and all that affect us in terms of movie stars, in terms of, I've watched some news reports in the Oklahoma City area that were like anti-vaccines that just irritated me. We have to provide leadership to the media to get the real story out, because unfortunately our story is not the sensationalized story, okay? But it's the right story, and so it's not just a parent physician or child physician thing. It's a national thing, and when you include national things, you have to really influence blogs and like you do and media. We need to do a better job.
And I think, coming at from a perspective of, I'm here to help you and your family. I'm not here to tell you what to do and what's required of school and what's required of the law or whatever. I think it's get to know where they're coming from and speak to them in a way where it's like, yes, we do take care of our children. We put our children in a car seat to come here today. We baby-proof our houses. We do all these things to help keep our children safe, and this is just another way. If they're confused about it, ask them about it and see where they're coming from as far as what are their reasons behind having this hesitancy. And maybe on that visit we can help them. Maybe we encourage them to go home and look up things on their own, or maybe we just plant a little bit of a seed. Here at the health department, we don't get to see people over and over like you guys often do. We may only see them every few years. So just planting that seed to go home and find out for themselves rather than listening to everyone else, I think, is a big step that we can take here.
Can I say one thing real quick? Go backwards real quick.
So-
I want to say one more thing, and that is I've done some national conferences and sat on panels and stuff like this. When you look at vaccine acceptance, and the vaccine company people that are in this room will tell you this, you can struggle trying to get an OBGYN to give HPV vaccine, or a family practice person to give this, or an internal medicine physician to give pneumococcal vaccine. Pediatricians do the best with vaccines because we're the biggest advocates. But the way that we've been able to be successful is by law, okay? Until vaccines are required by law, you struggle with vaccines. And so it's really important that, for instance, we're having problems with HPV. We didn't talk a lot about HPV today. Part of the problem is we should have a law that says that you need to have that vaccine. I would personally pick driver's licenses. You can't get a state of Oklahoma driver's license unless you had HPV, because every kid wants a driver's license. At 16, that kid will have HPV, okay? State laws are extremely important in putting pressure on state legislatures, despite the politics, is something that's going to be key in the future for vaccines.
Tom?
I think just to go on with what he was saying, you have to have a huge mouth. You have to talk a lot, whether you're a provider or just a parent or some guy at Walmart. It doesn't matter. Just put it out there as much as possible, because I'm not as cool as a celebrity, so it's like, but I have a bigger mouth than a lot of them, so it's like it's really just constant PR campaign from both sides, and you just have to keep educating as much as possible.
Dr. Ellis?
And, you know, I agree with all the sentiments of everybody up here, and I think one of the other areas that we can do is we can talk with our GYN counterparts, and when we do, I know that I do some of the well baby classes, I know Dr. Milligan does too, and part of that we discuss the vaccines, and, you know, even talking to parents before their babies are born about the importance of vaccines and how much it means to the health of the child going forward about having the vaccines, and just really stressing the, you know, that they are important and they do protect against these really serious diseases. And then for those who are really struggling with it, you know, trying to sit down with them and talk about some of the science behind it. And I know that not all the parents want a science lecture on, you know, how the vaccines are made and how they work and that kind of stuff. But the other day I had a mom who came in and said, I just wish there was something we could give that was just a little bit of something that would help the body build its own immunity to these illnesses. And I'm kind of like, that's exactly what a vaccine does. And so, and that kind of just no understanding of what the vaccines are is some of the stuff we're dealing with. And so, so go out and educate everybody, your friends, your family, your neighbors, people you go to church with, people you see at Walmart, wherever you are. Educate people on the vaccines. They're there for a reason. I do think we should still push the vaccine manufacturers to make the vaccines safer, more effective, and less painful when we give them. I think those are the questions we all need to continue to ask. But right now, they're as safe as they can be. They're as effective as they can be, and I think the schedule is good.
Well, that concludes our panel discussion. Thank you, panelists, for taking the time to share your wealth of information. And thank you for everyone taking your lunch hour to come hear what they have to say. Again, this is being recorded, and it will be on our Cleveland County Immunization Coalition Facebook page. The link is on little business cards, or it's facebook.com #CCICOK. My email address is also on the little business card. So if you have questions or follow-up questions about some of the things that our panelists said, please feel free to contact me. Thank you so much for coming. There might be food left, so thanks.